Hello, good morning, good afternoon, good evening, wherever you are. Welcome to a new episode. Together we do better. Today we're going to talk about diabetes because this is what this show is about. So, what's diabetes? Diabetes means there is a high level of sugars within the blood, and happens because there is a hormone called insulin produced from an organ called pancreas that's responsible about the insulin production. If there is an insulin deficiency or there is a insulin but the body cannot use it in appropriate way, or there is what we call insulin insufficiency, then diabetes develop. If diabetes develop, it can be either with no symptoms at all, depends on which type of diabetes, or it can be symptomatic. If it's symptomatic, that can be presented as excessive thirst, excessive urination, especially at night, unexplained weight loss, fatigability, tiredness, blurring of vision, or a slow or poor healing of wounds. Why is it important to know which type of diabetes? Because this will guide the management and the treatment moving forward. The most common types of diabetes is type 1 and type 2, but there is others like gestational diabetes, which means diabetes in pregnancy. There is a pancreatic diabetes, genetic or a drug-induced diabetes. So if we talk about type 1 diabetes, there is a insulin deficiency, so the body has no insulin production, and the treatment will be dependent solely on insulin replacement, and this is going to be a lifelong. If it's type 2, there might be an insulin resistance, which means there is some insulin within the circulation, but either the body cannot take it or is not enough. And the treatment for type 2 can be through diet, exercises, tablets, plus or minus insulin. Gestational diabetes is the diabetes that happens during pregnancy, and it can resolve after the baby delivery, or it might happen in another further pregnancies. Sometimes it can develop into type 2 diabetes. And we're going to talk about the importance of the gestational diabetes to be picked up, diagnosed, and managed. There is a pancreatic diabetes, which is related to a direct problem within the pancreas, and it will happen due to chronic inflammation of the pancreas, can be excessive alcohol intake, could be related to a direct injury to the pancreatic tissue. There is another type of diabetes called latent autoimmune diabetes, which has characteristics between both type 1 and type 2, and its management can be either with diet and tablets similar to type 2 or with insulin similar to type 1. There is a drug-induced diabetes, which is certain medication like steroids can cause high blood sugars, leading to development of diabetes. And there is a genetic diabetes, which will be identified on genetic testing. We're going to talk about these types of diabetes in details in the coming episodes, so stay tuned and we'll speak to you soon. Bye.